Hello, my name is Dr. Hartman from Westwood-Mansfield Pediatrics. What we're going to talk today about is when a sore throat means something more than just a sore throat. This is strictly for patients in Westwood-Mansfield Pediatrics. Your pediatrician may have different advice. Well, we've shown you how to do the strep test and how to process the strep test. We want to talk a little bit more about other things that may cause sore throats that can be far more serious. First of all, the mass majority of sore throats are viral. In other words, they don't need an antibiotic, they will go away on their own. 65 to 75% of children who come to Westwood-Mansfield Pediatrics for a strep test are negative for strep. Now, interestingly enough, the peak time for strep in ages is between 6 and 12 years of age. And the peak seasons are January through March and a little bit into May as well, interestingly enough. Why there's a break in April, I don't understand. But when people come in, for example, in July for a strep test, 90% are negative and only 10% are positive. Whereas in the season, even in January, it's 50-50. 50% are positive, 50% are negative in the peak season. Now, more serious causes of sore throats are oftentimes not between the ages of 6 and 12, but rather older than 12 or younger than 12. And I'd like to address a few. The most common one we see is mono, infectious mononucleosis, the Epstein-Barr virus. Oftentimes that's in kids older than 12 years of age who parents suspect their child may have strep throat. Now remember, mono occasionally, about 10% of the time, will have strep with it. And when kids are put on antibiotics for it, they don't get better. So mono basically is bad swollen tonsils, feeling tired, moderate to high fevers, and the tonsils will swell up quite a bit. And when we do a strep test, the strep test is negative, and because of the age group, we'll check for mono, which we can do in the office. And if it's positive, we discuss with you what you need to do. Oftentimes it's just fluids and lots of liquids and rest, and sometimes it can vary from a few days to a few weeks before kids recover. And sometimes if the tonsils get too big, we have to use a medicine called steroids to help shrink the tonsils if kids can't handle swallowing their own saliva, which can happen over the first few days. And then there are other things that you need to talk to your doctor about as well. Then there are things like kids under 6 years of age. Typically, one is called retropharyngeal abscess. This is an abscess in the side of the neck back here, and oftentimes kids complain of a stiff neck, and sometimes parents think it's meningitis, and sometimes their head is tilted a little bit here. Some kids will have a new onset of snoring as well. Retropharyngeal abscesses we may see one every year to every other year, so it's pretty rare. Kids have trouble swallowing, just like with strep. Remember, with strep it hurts to swallow, and it's very rare it doesn't hurt to swallow with strep. But retropharyngeal abscesses are much more serious, need to be put on intravenous antibiotics, and at times taken to surgery to drain the abscess. Remember, they often complain of a stiff neck. They're usually under 6. Sometimes they can be as old as 17, but usually it's under 6. With it, and their head may be tilted, or they may have new onset snoring, and they can oftentimes, not always, but look pretty sick, and your gut will tell you there's something really wrong. Then there are things such as kids swallowing something and having a foreign body in their throat, like a coin or a bone or something like that, and they'll complain of a sore throat. Again, those are kids often under 5 who don't necessarily report that they swallowed something. This is also a potentially serious problem. Kids usually don't have a fever with that, and it's very rare. We see once every 5 years, I think at most, do we see somebody who has a foreign body like that as well. And that can choke and obstruct the airway and be extremely serious. Those warrant an emergency room visit via probably ambulance. And then there are rare things. There's something called epiglottitis, which is very deadly. It's an inflammation of the epiglottis, which sits like this in your throat, like a garbage can lid, to prevent things getting into your airway when you swallow. Now, That's almost non-existent, but it has started to come back a little bit because the Hib vaccine, Haemophilus influenza type B vaccine, where people have refused to start giving their kids vaccines. And for 20 years we had not seen a case, and there are some fairly recent cases as a result of not giving the Hib vaccine, and it's potentially deadly. The way you tell the difference there is there's serious, serious drooling with it, and the kids are bent over and they're breathing like this. Slow, quiet, excuse me, breathing like that. And there's something also called bacterial tracheitis, which is similar to epiglottitis, however you don't have the drooling with it. But that noise, bent over, shoulders forward, and that's extremely serious. So those are the causes of sore throats that can be serious, that are very rare, and usually happen before the age of 6 or after the age of 12. Remember, the peak age of strep is 6 to 12, and the peak seasons are January through March, and also May as well. This is Dr. Lester Hartman. Thank you very much. Proactive in Westwood-Mansfield Pediatrics, proactive in your child's care. Have a good day. Thank you.